Jo here from Rototuna Physiotherapy Clinic. Today we're talking about ankle sprains. So we get lots and lots of patients that who trip over the dog or trip over at netball or playing soccer and roll their ankle and come in with an ankle that looks a bit like a balloon. So here are your top tips for looking after your ankle. So first things first, it's the RICE acronym with any acute injury. So RICE stands R for rest. So you need to actually put your ankle into something that will rest it, because we walk on it all the time. So that might be a moon boot, it might be coming in and seeing us and we can tape it up for you, or it might even be going onto a pair of crutches depending on how badly you've injured it. The next thing is to get the ice on it as soon as possible. As soon as you've done the injury, sit there for 10-15 minutes with some frozen peas or an ice bag on it, and then for 48 hours try and put ice on it as often as you can. The next step is to compress it, so whether you get one of those stretchy bandages or if you go to the $2 shop and get an ankle brace, something that's going to put some pressure on it and get rid of the swelling. And if you do sprain your ankle, try and keep your shoe on, and that will stop it swelling as you take your shoe and your sock off. And the final thing you want to do is elevate it, so as much as you can when you're in a sitting position, try and have your ankle up above your heart. Now, this is our ankle. So this is looking at the outside of your ankle. So this is your fibular bone here. This is your fifth metatarsal coming through here. And this is your tibia. So this is your main load-bearing bone of your ankle. So when we do a lateral ankle sprain, we tend to roll over into this direction here, and we damage the structures that are on this particular aspect of the foot. So the first structures that we normally damage are your ligaments. So you've got three main ligaments. They normally go by the name ATFL, and they basically come from your fibula to your talus, and then from your fibula also down into your calcaneus and one of your other ankle bones through here. The main one we damage is the one that comes from your fibula into your ankle bone itself. There's a couple of other structures that you can damage when you roll your ankle that need to be picked up on. So the first one is your peroneal tendons. So they run down the outside of the fibula here, round the back of the ankle joint, and one comes and inserts into the base of your fifth metatarsal, and the other one actually dives under your foot and attaches into the base of your foot there. So the other thing you can do sometimes is that you don't actually damage the ligaments. You can actually have a positional fault of your fibula. So the fibula is this guy here, and he actually, as you roll over, pops forward. And you can see this if you were to put both feet beside each other and have a feel of where that fibular bone is. You'll feel that it's far more in front than the other. And that's a really important diagnosis, because it's really easy to mobilise it back into position and place some tape on it. So once you've got your correct diagnosis, the next step is to get some proprioceptive feedback going back into the foot straight away. So proprioception is the concept that we know where our foot is in space without having to look. So every time we walk, we don't have to look down at our feet to see what's happening. So it's messages from the receptors in your ligaments and in your ankle to your brain to tell you what to do with your foot, so that you can mould to the surface that you're walking on. And we know that as soon as you get any pain or swelling in the foot, you lose that ability. And that's commonly why people get recurrent ankle sprains too, is that they strengthen the muscles and get the positional faults correct, but forget about the proprioception or the balance aspect of the foot. So you can start looking at balance things, for example standing on one foot, doing the star excursion tests, which are all things that we can show you and help you with. The fourth stage that you get into somewhere around that 4 to 6 week mark is getting some good calf strength and some everter strength. So there are two muscle groups that help to stabilise your foot and give you a nice stable ankle. Then the final step is getting specific. So you can have an ankle where you've broken the ligaments completely and they potentially will not heal, but you can have a nice stable ankle as long as you've got some good proprioception and some good specific strengthening. So if you're wanting to play netball, you need to be able to hop and jump and leap. If you're wanting to play soccer and hockey, you need to be able to change direction, and these are all things that you'll need some help with training to prevent further ankle strains. Hope that's been helpful on ankle sprains. We'd love to hear from you if you've got any questions or queries. Feel free to contact us on rototunaphysio@extra.co.nz. Thanks.